Would you guys pay for faster health care?
No.
If I felt it was urgent, of course.
I think that's a slippery slope, and I don't know if I'd feel comfortable doing that.
I agree about not getting people to jump the queue. Just how do you make sure you just have resources available for the people that need them?
I know some people that had heart issues, and because of these waiting times, they passed away.
It gives you two classes now of who can afford it and who can't.
For me, I would just, have the patience to wait.
Initially, we pay enough taxes for this.
In other countries, it's way cheaper, and you pay, you get the treatment right away. But it doesn't mean that we don't have good health care. We have good health care, it just takes a little bit of time.
The Canadian Medical Association warns that our healthcare system is facing collapse. ER closures, long wait times, a shortage of family doctors. Could increased access to private healthcare be part of the solution, or would it make things worse? Tonight, we have Dr. Adam Hofmann, co-founder of Algomed, a chain of private clinics based in Quebec. He is in New York. And Dr. Melanie Bechard is the chair of Canadian Doctors for Medicare. She joins us from Ottawa. Dr. Hofmann, we'll start with you. Describe the need that you see and how you say your model works to fill it.
So I was an ICU doctor for many years, and I used to see patients come into the ICU with preventable disease, heart attack, stroke, advanced cancer, and the story was the same every single time. They didn't have family doctors to screen them. They didn't have access to primary care. Right now, in certain places in Canada, up to 1 in 4 people can't actually access primary care, which raises the question, do we actually have a public healthcare system if it is not able to be accessed by 1 in 4 people in the population? Is it equitable? Is it accessible? Is it free if you can't actually access it? And then having my patients suffer horribly, unnecessarily as people, and then bring those costs to the healthcare system and fill up our already overcrowded emergency rooms, to me was morally untenable.
I'm just going to jump in there because I'd like to get Dr. Bechard's reaction to what we're hearing. What do you think about what Dr. Hofmann is saying, that a lot of Canadians can't access a family doctor and clinics like his would make things better?
I think absolutely our healthcare system is in crisis right now. I work full-time as a pediatric emergency doctor, so I'm seeing firsthand the difficulties with access. What I would propose, though, is that creating parallel private pay options does not solve these problems. In fact, it actually tends to worsen them. We have a limited number of doctors and nurses in Canada, and if we pull them out of our public system to work in these parallel private pay ones, we're going to have less healthcare providers to care for the majority of patients who still rely on that public system. We've seen this in other countries like Germany and Australia. When they created parallel private options, they actually saw worse wait times for the majority of people that relied on the public system. So we need to organize our care more efficiently if we want to address the very real, very severe problems we are seeing.
So Dr. Hofmann, what's your reaction to that? She's arguing that pulling people out of the public system is actually going to make things worse.
I very much agree with the last thing that Dr. Bechard said, is that we have to organize our systems much more efficiently. And in fact, at the Algomed clinics, we have done that. We have actually solved the problem of the doctor shortage in Canada. Using technology and processes, we've actually made our family doctors and nurse practitioners 10 times more efficient than a doctor working down the street in a traditional primary care practice. That being said, consider the math. If 1 in 4 Canadians don't have access to primary care, and we can provide it 10 times more efficiently, there actually is no doctor shortage in Canada. There is simply a shortage of innovation.
And Dr. Hofmann, one of the arguments critics make is that by pulling these doctors out, you are claiming to be more efficient, but it's making the public system less efficient because there are fewer doctors that people can access in the public system. How do you respond to that?
That's completely false. First of all, the public healthcare system is currently overwhelmed. The hospitals are filled to the brim because people can't access primary care. At our Algomed clinics, for $42, you can get a visit with a primary care practitioner that would save the taxpayer a $500 emergency room visit. And we can do this in under an hour, when in the emergency room, in Quebec at least, you could be waiting 18, sometimes 24 hours to see a doctor. So the idea that the taxpayer should be shouldering a burden when we could provide it using technology and processes 10 times more efficiently than the current public healthcare system, to me, is morally untenable. In fact, like I said, we don't actually have a doctor shortage in Canada. We simply have a lack of innovation and a lack of improvement in efficiency, the way Dr. Bechard had said.
And Dr. Bechard, what do you say to that? I mean, in some respects, you're both agreeing that we have a lack of efficiency. So what's the solution?
I think there's a lot of efficiencies that are truly evidence-based that could help fix our healthcare system. And regardless of what's happening at these specific clinics, when we look at the healthcare system in general, we know that multi-payer systems are less efficient. They have much higher administrative costs. When I provide a service at the hospital, I click a button, the hospital receives payment. I don't need to badger my patients for payment. My patients don't need to argue with their private insurance providers for hours to get medically necessary coverage. So there is a lot of efficiency inherent in a universal public single-payer system.
CBC has done a lot of reporting on the situation in Canada's hospitals, and Marketplace recently spoke to one woman who was forced to fly overseas to get treated for her endometriosis because the wait times here were too long.
It destroys your fertility the longer you wait. Yeah. So you don't have time to just sit around and hope that you'll get a call.
That's really sad to know. That's our reputation here, that people need to come so far away in order to receive care.
So, Dr. Bechard, it is clear that people are frustrated, they're suffering. Briefly, what do you say to the argument that we need to open our minds to other models?
Absolutely, we need to look at new ways of delivering care. And my heart honestly goes out to that woman. No one should be in that situation. I think it is really important, though, to keep in mind that what's being proposed when we talk about private pay healthcare is likely going to worsen those wait times for the majority of people on those wait lists.
All right, well, clearly very differing positions. Both of you, final thoughts, and we'll start with Dr. Bechard.
The only circumstance where I can see private pay healthcare being better at delivering medically necessary services is that it tends to make certain people more money and people with deep pockets get faster access. Those are the only advantages, and unfortunately there's no way to implement that in our current healthcare system without fundamentally undermining our public healthcare.
And Dr. Hofmann, your final thoughts.
We deployed our very first clinic in the town with the second lowest per capita income in the country. And we had people on welfare come and pay $42 to access to access our clinics because they couldn't find access in a public healthcare system. Fundamentally, we are offering care 10 times more effective and 8 times cheaper than what you get at your family doctor's office, if you can get it at your family doctor's office down the street. It is both financially, mathematically, and morally untenable to have 1 in 4 Canadians fail to access primary and preventive care and then cost our system huge amounts of money, but more importantly, suffer the tragedy of preventable disease and the inability to access care.
All right, well, clearly a hot topic, an important one, and I thank you both for your insights.
Thank you.
Thank you.